microRNA expression is an amazing angle. It's probably like a valuable added, if you like, line of evidence to the effects of the drug that we would see in Alzheimer's disease. So in Alzheimer's disease, in Parkinson's disease, in the dementia with Lewy bodies, we have been doing what we call an unbiased analysis of the whole genome microRNA in the cerebrospinal fluid. So this is specific to the cerebrospinal fluid. We're only looking at microRNAs. And why microRNAs? MicroRNAs are very stable molecules. They inversely, if you like, regulate the expression of a messenger RNA, which in turn translates into proteins. So what we have managed to see in in over 300 patients right now, and these patients are tested, the CSF is collected at baseline versus end of treatment, like almost 600 samples, that microRNAs are very highly stable, number one. And number two, we are able to detect the entire CSF microRNA genomes in these patients. Surprisingly, what we see there is, even though it's harder to determine the effects of a drug on the blood-brain barrier, for example, we see that microRNAs over, let's say, 1 year of treatment in the placebo go in exactly opposite direction to microRNAs in a nilotinib-treated patient. So that means that the drug has an effect that is detectable via what we call epigenomics rather than a protein or protein effects that we measure in the cerebrospinal fluid. The three main things that we actually see in microRNAs, and that's what we're seeing in preclinical models, and that's what we partially, to the extent that we can measure, amyloid or inflammation or other things in human. We've seen three major effects of the drug. It affects microRNAs that control gene expression of autophagy, microRNAs that control the gene expression of inflammation, and most importantly in our case here, and that's why we think there is a huge effect and a huge benefit of nilotinib on top of the anti-amyloid therapy. The nilotinib does actually significantly alter microRNAs that control blood-brain barrier integrity. So, these three effects that we see in preclinical models of neurodegenerative diseases, including Alzheimer's disease, are actually seen, as robust, measurable, significant changes in the microRNAs of patients, who are, or of individuals who are diagnosed with Alzheimer's disease. So that's why we are very excited about this, if you like, complementary, method that adds to the amyloid PET that we do, measurement of CSF and plasma tau and beta amyloid, probably neurofilaments, and probably some of the inflammatory markers that we see, and also some of the volumetric MRI to measure edema and to look at edema in the brain and to look at whether there is any ARIA in the brain. So these are all complementary methods that basically give us a greater, if you like, greater confidence that our drug has a specific mechanism of action, and that specific mechanism of action is all desirable effects that we would want to see on top of whatever standard of care exists right now.